Hello everyone, this is Dr. Ranjan with Pran Clinic. I'm giving these recommendations for self-care in the instance that you get infected with COVID-19. These recommendations are heavily supported by scientific literature, and we also have decades of experience in taking care of very sick patients in the hospital and ICU. We have been following the same recommendations for our friends and family, and so do other doctors. Compared to other respiratory viral infections, such as influenza, COVID-19 is particularly scary because it has a higher chance of causing ARDS, which can cause death. Otherwise, we won't be worried so much. White House projects total mortality numbers to be about 100,000 or more. We'd like to not reach that number and prove them wrong. What I discuss here doesn't do anything for how many of you will get infected, but may impact on how many of you will get very sick or die. You can email us with questions, but please put COVID-19 in the subject line. These are some of the very selected papers on which I'm drawing my recommendations. You can check them out yourself and confirm. Please read this disclaimer carefully. I'm not your doctor. You should follow your doctor's advice, and if you get sick, please consult your doctor. What I say here is meant only for your educational guidance. You can also log on to cdc.gov and get recommendations from right there. So COVID-19 begins as an infection of your upper respiratory tract and then moves down to your lungs and then causes pneumonia, which can progress to ARDS. And that is ARDS, which can cause death. In almost all the cases of death due to COVID-19, it is ARDS which is causing the mortality. My recommendations here are to stop that progression and prevent you from reaching ARDS. And they are very simple. They are gargle, steam, and cough and clear. Gargling with any antiseptic mouthwash, warm steam, and cough and clear. If pneumonia is suspected, then aggressively cough out all the sputum. You may have to use bronchodilators, which I'll get into a little bit detail later. And you must start antibiotics and antiviral treatment under your doctor's guidance. And that has to be started early, not late. What is COVID-19 virus? Coronaviruses have been around for a long time, since 1960s. COVID-19 is more dangerous because it is highly contagious. It is more resilient. It can live for days on inanimate surfaces, and it has higher chance of causing ARDS. And then there are no known good antiviral medicines as yet. On the good side though, it stays in your upper respiratory tract for about 2 to 5 days. It is killed by heat, so temperature higher than 56 degrees. And it's killed by many common antiseptics. You can get the list from EPA. So this is a normal respiratory anatomy. Air or virus can enter through your mouth, go through your throat, through your larynx or larynx or voice box, through your trachea and bronchi, into your lungs. And lungs have microscopic units of air tubes which go into alveoli, which is where the air exchange takes place. So COVID-19 or any virus enters through your mouth, stays in your upper respiratory tract for some time, for a few days, then moves down your trachea and bronchi and affects your lungs, causing pneumonia. So what is ARDS? ARDS is acute respiratory distress syndrome. It is not completely understood. Any major trauma to your lungs or severe pneumonia can result in ARDS. Body's own immune system tries to heal the situation. In that process, causes more inflammation, which can cause ARDS. That sets up a vicious circle. In ARDS, both the lungs are very much inflamed, full of fluid, which is growing bacteria and virus, and the air exchange is almost impossible. These patients require breathing tube to be placed through their mouth into their trachea, and the breathing tube is connected to a breathing machine to help the patients breathe. Most of the mortality in COVID-19 infection is coming from ARDS. So the message is, in all of the respiratory virus infections, it is ARDS that causes death. ARDS is almost always going to be the cause of COVID-19 mortality. If you can prevent it from going that far, you may get sick, but you'll likely be fine and emerge from it. These recommendations are to describe, these recommendations that I describe here are to arrest that progression. And the ARDS almost always follows pneumonia. Therefore, we want to prevent pneumonia from happening. And if pneumonia happens, then we aggressively treat it. So just as I said, in the early phase, the virus stays in your upper respiratory tract, and the symptoms are sore throat, fever, dry cough, and hoarseness. You take care of this with some Tylenol. Do not take Motrin or ibuprofen type drugs because they have been shown to increase the virus replication. You take antiseptic gargles such as Listerine or chlorhexidine mouthwash, and you do warm steam inhalation. Both of them will affect your throat and inactivate and kill the virus right there. If the infection reaches further down into your trachea and bronchi, then there is more secretion accumulating there. You need to cough and clear all that secretion. Taking warm steam inhalation will loosen up the secretion, improve immunity in your trachea and bronchi, and help you cough and clear all the secretion. These secretions have viruses, and you do not want that to reach inside your lungs. If the infection reaches your lungs, now you have pneumonia, which is infection in your lung. The breathing tubes are narrowed, so air exchange is difficult, and you have difficulty clearing out the secretions where the virus and bacteria is growing. The symptoms are fever, cough, more sputum, chest pain, and maybe breathlessness. At this time, you have to be very aggressive with this in coughing and clearing all the secretion. You may need bronchodilators to open up the air tubes. Bronchodilators are compounds that open up your air tubes by reducing spasm. It can be a puff, it can be a tablet, or it can be pseudoephedrine in your cough syrup, or if nothing, then it can be caffeine, which is present in your coffee and tea. You take some bronchodilator followed by steam inhalation, then you vigorously cough and clear. Coughing is really good for your lungs. It is good exercise for your lungs. It opens up your lungs and you can clear all the secretions. But at this stage in pneumonia, you also need to take antibiotics and antiviral agents, which has to be prescribed by your doctor. The idea is that you must reduce viral and bacterial load from spreading throughout your lung and causing ARDS. So again, simple steps to contain severity is gargle with antiseptic mouthwash, warm steam inhalation, and cough and clear as much as possible. If pneumonia is suspected, then aggressively clear your lungs using bronchodilators and steam as needed, and start antibiotics and antiviral treatment as early as possible with the help of your doctor. If you have breathing fast and your lips are turning blue, that is a bad sign, and you need to go to the hospital immediately and get yourself checked out. So most important thing is that we can stay home and take care of ourselves right there. Stay home because that is the safest thing for you and for everybody else. Let's see if we can beat that White House number of 100,000 deaths from this virus. If you have any questions, you can email us directly, but please put COVID-19 in the subject line. And as I said, it is a philanthropic clinic, so there is no charge for any services. Thank you very much.